We're watching the White House briefing with Robert Gibbs, and he's just talking about the whole taxes thing, the president's pledge not to increase taxes, and then people from his cabinet saying, well, you know, everything's on the table. Are we going to listen in here, Alan, or are we not? We're not going to listen, and what he's just said is, look, the deficit's bad, you've got to address the deficit, but the president is committed to his campaign promise not to raise taxes on the middle class. We'll bring much more from Robert Gibbs as it comes in. I want to bring in our next guest, Texas Congressman Michael Burgess. He's a Republican member of the House Energy and Commerce Committee. He's also a doctor. And Judy Feeder, who's a senior fellow at the Center for American Progress. She was Deputy Assistant Secretary for Planning and Evaluation at the Department of Health and Human Services under Bill Clinton. And Congressman Burgess, I mean, the question here that Robert Gibbs just addressed was, look, we know health care is bad. We know it's expensive. We don't know how we're going to pay for it, but we're not going to raise taxes. Are you buying that?
No. You know, one of the interesting things about this bill is, and people seem to forget it, is the tax consequences hit the American people almost immediately. The increase in coverage begins 2012 or 2013. If I were cynical, I'd say after the next presidential election. So the cost doesn't come in for several years, but the tax consequences will hit small business and the American taxpayer really as soon as the ink is dry on the president's signature.
Judy, we're going to give you a chance to respond here in a minute, but I want to dip into Robert Gibbs' briefing. The daily press briefing, he said again and again the president will not raise taxes on the middle class. He said nobody who makes below $250,000, which was his campaign promise. And the question was asked, did Treasury Secretary Tim Geithner and Larry Summers go off message yesterday when they said, well, everything is on the table and not ruling out a middle class tax increase? Let's bring back in Congressman Michael Burgess from Texas and Judy Feeder. She is with she's a senior fellow at the Center for American Progress. And Judy, I guess he's saying that there will be no new taxes in the middle class. But I want to talk about health care with you for a second, because the bottom line here is the American people are speaking out. And every time the president goes on the road, every time the president comes out and talks about health care, the numbers go down. The American population does not like the health care plan. They like the plan they currently have.
Well, I take issue with you there. The American population, and let's just talk about people that I'm sure you as well as I meet every day, are really concerned about how health care is eating up their incomes, and they're concerned about holding on to their coverage. No new poll takes away the fact that people are losing coverage every day, that they worry that they are going to lose their homes in foreclosures because even when they have insurance, they can't afford their health care. People know that the health care system, even though what they like, and we all like, many of us like, our relationships with our doctors, wanting to keep the plan we have.
They just don't like this plan, Judy. That's the bottom line, Congressman Burgess. That you can say everybody wants reform. Everybody wants things changed. They just, Congressman, do not like this particular plan that's coming out of the House.
Well, it's really hard to tell what the plan is coming out of the House, to tell you the truth. I don't think we've really settled the policy even after our third and final committee had its vote, because after all, in September, we have to go back in and settle about 50 different items that weren't settled as we finished up on Friday evening. So it's anybody's guess what this thing will actually look like by the time it comes to the House floor sometime this fall.
Congressman Martha McCallum here. Do you go along with this notion in terms of the economy and what's causing this deep deficit? What we're hearing a lot from the Treasury Secretary, and we've heard it from the President, is that one of the main problems with the economy is the rising cost of health care. Do you agree with that?
Well, the rising cost of health care is a factor, but right now the number one thing that's damaging to the economy is the incredible job loss that we've seen, and anything that puts a roadblock or a higher bar for creating new jobs, like a employer mandate, for example. These things are going to make it more difficult for small business to reestablish those new jobs. So what this policy actually looks like is of critical importance as far as recovery in jobs. And I'll just say this about Secretary Geithner: nothing happens in Washington by accident. That notion that there may be a tax increase coming was planted.
So you believe he was floating a trial balloon? Because that's exactly the back and forth we just saw with Robert Gibbs. He says, because Chip Reed said, so you're opening the door here a little bit to the possibility that taxes could go up in the middle class, and they went back and forth on that issue. issue, but you believe they were sent out there to float that message.
Well, after 8 years, I still consider myself a neophyte, but things don't happen by accident in Washington. That's the one thing I've learned over the short time I've been there.
So if that's the case, Judy, one quick question to you. Do you have any sense, you worked in the Clinton administration. We watched what went, all the good intentions to kind of fix the healthcare system in this country fell apart there. Do you see anything similar happening right now?
I think that the pressure and the demand, the need to reform our healthcare system is so strong. President Obama's commitment is so strong, and the Congress's commitment. We've got the 3 committees of the House getting bills through in record time, waiting for another committee in the Senate. We're moving forward. And on the issue of what is the problem, even the tax on the American people, the barrier to job growth, rising health care costs are fundamental to that, and what we're looking at.
I think the problem is that people aren't convinced that, I think you're so right on target that people want to see things fixed. The problem is that these numbers are showing that they're less and less convinced that this is the way to get there.
Now, the information I've seen is that when they see what the plan's doing, when the real information gets to them, they like it just fine. The clips that you're showing on town hall meetings, those aren't spontaneous uprisings of voters and of people living in communities. They are well-organized events sponsored by Americans for Prosperity, who have actually put out a manual for their folks on how to go and make their numbers look bigger, make their noise look louder. They're the ones who are in the way of getting the real information, and the information is.
Let me just jump in very quickly, if I can, Judy, because I want to, on that point,
I can't get that information out. Go ahead.
I want to get just because in your state, Congressman Lloyd Doggett had a town hall this weekend. He was run out. I mean, this thing was advertised mostly in liberal publications, and he showed up and didn't read the bill and was pretty much run out of his own town hall.
In my state,
I'm going to have 2 town halls.
Go ahead, Congressman.
No, it's in Texas. Lloyd's from Austin.
I apologize, right.
I'm having 2 town halls this coming weekend, and I fully expect both sides to be fully engaged by the time I get there. What's telling, though, is when you do what's called a telephone town hall, where you just basically show up in people's living rooms on a telephone call in the evening, and there's really not the opportunity for either side to plan an assault. When I did that earlier this week, it was 90-0 that people were skeptical that their government, they can't run the most basic of programs, is going to be able to run something as complicated as health care. No one believes we can do what we say we're going to do.
Texas Congressman Michael Burgess, Judy Fader, thank you both very much. Good conversation.
Thank you.
So you heard Robert Gibbs just